morning. Senior Pride here. Today I'm going to discuss an issue that for Albertans is extremely significant. For Albertans with disabilities, for Albertans who are seniors, or for Albertans who are in both groups, it is quite life-threatening. It is the decimation of our healthcare system, and you may be from other places, you may be from other countries, but remember what is happening here because of a right-wing government will or is happening everywhere. It is interesting that Alberta, which is Canada's fourth largest province, actually used to pride itself on a very accessible, very robust healthcare system. That is no longer the case. There have been a number of issues that have caused this decimation of the healthcare system, including political or fiscal austerity, the extreme right-wing political shifts, and inefficiencies in the system. This, as I said, this decline or decimation has serious consequences for those of us who are older, for those of us with disabilities, and for those of us who are in both groups. So historically, Alberta had one of the strongest healthcare systems, public healthcare systems. And for those of you who are not from Canada, please know that we have universal healthcare, that we have public healthcare, or did. Alberta's changed those things a little bit. Originally under the Canada Health Act, Alberta did adhere to the principles of universality, comprehensiveness, and accessibility, ensuring that every resident had access to healthcare. Around the mid-2010s, around 10-15 years ago, a series of policy decisions began cutting this apart. So first of all, there were budget cuts and privatization. This comes from austerity measures, and they say that they need to balance budgets and reduce public debt. What it's included in healthcare is layoffs, closure of rural hospitals and clinics, privatization of certain services, which many of us cannot afford, and the argument for the privatization is that it would alleviate the stress on the public system. This doesn't work if people can't afford it. In fact, what it has led to is significantly longer wait times, even for a blood test, out-of-pocket costs that, as I said, many can't afford, and for those of us who are in vulnerable populations, reduced access. There were also issues that came from the pandemic. So COVID-19 kind of exposed the fragility or the weaknesses in our healthcare system. Hospitals faced overwhelming demand, staffing shortages and burnout became a significant issue, compounding the problem. And those of us who are already at risk, being older or disabled, were disproportionately affected. So what are some of the challenges facing older people? First of all, of course, there's the rising healthcare costs. The universal system in Canada is meant to cover most healthcare needs. But here in Alberta, certain services like specialized care, long-term facilities, home care, and prescription medications are not fully covered, and they are not accessible to people on fixed incomes. Long-term care crisis is also an issue. Many facilities are understaffed and underfunded, which leads to substandard care. In 2021, a report by the Alberta's Auditor General revealed widespread deficiencies in long-term care homes, including inadequate infection control, insufficient staff training, and poor oversight. What this translates to is lower quality of life for seniors and increased health risks. and increased mortality. And as someone living in one of these facilities, I can certainly attest to the fact that there are significant deficiencies. As well, there is a limited access to geriatric care. As we know, geriatric specialists are important to address the significant kinds of complex issues that seniors face. But we have a huge shortage of geriatricians and age-friendly medical facilities. Some seniors have to travel long distances, and this can be an insurmountable issue for those of us with mobility issues, limited finances, sight impairments, those of us who don't have access to a vehicle or cannot drive because of our issues, our health issues. So what are the challenges that face disabled people? Again, barriers to accessibility. There are many healthcare facilities that are not accessible to persons with disabilities. And this can be like a lack of wheelchair ramps, inadequate transportation. It makes it very difficult for disabled people to access healthcare. Telehealth services, while they're growing in popularity, are not always accessible. And again, as someone with vision and hearing issues, I can attest to this. There are also reduced support services. Budget cuts have slashed fundings on community-based programs and services used to support disabled individuals. So programs that provide personal care, mobility aids, and mental health counseling have seen significant reductions, which leaves many people with disabilities without the resources they desperately need, and it leaves those who did not have mental health problems in both populations in a more vulnerable position, increasing the need for mental health services while they are being reduced. And there is a mental health crisis in Alberta. Because we're at higher risk of experiencing mental health challenges, including depression and anxiety, there is increased deficiencies in the system, there is increased isolation, there is increased discrimination, and the supports just aren't there. So many people with disabilities or seniors who have mental health concerns are left untreated. Now, what happens when aging and disability intersect? The challenges become more pronounced, obviously. We often require a higher level of support and care, and of course face compounded barriers due to the fact that these supports are being withdrawn, not developed. The healthcare system is ill prepared to address the needs of this growing population because people with disabilities are aging or aging into the senior population, and we are not being provided with the care we need. There are some broader systemic issues as well. There's a significant shortage of healthcare workers. We've seen a wave of retirements, resignations among doctors, nurses, support staff. These issues are driven by burnout, low wages, and poor working conditions. And again, this comes back to government funding. Not surprisingly, this shortage disproportionately affects rural areas and underserved communities where seniors and disabled individuals have no access to clinics or hospitals. Hospitals are being closed in rural areas. Of course, there are significant wait times and overcrowding. And these are for surgeries, diagnostic tests, specialist appointment, ERs, everything. So for people who are older or disabled or both, these delays can lead to worsening of health conditions, increased pain, lower quality of life, increased mental health crisis because of all these issues. It compounds. There is also an issue of, like I said, closures in rural health facilities. So many of the rural hospitals have either been downgraded or simply closed. there is not affordable health care, there is not access to health care in many rural communities. This is an issue that I don't think people want to always understand, but it's important. It's the socioeconomic consequences of the cutbacks. It affects both patients and providers. So, for example, for patients, when we cannot access adequate health care, our health deteriorates, which means higher rates of hospitalization and long-term care admissions. This places strain on families who may need to step in as caregivers, often sacrificing their own income. As well, there's increased reliance on emergency services. So this actually drives up healthcare costs instead of reducing them as the government purports. So, for example, let's look at seniors living in rural Alberta. Many of them struggle to access even regular checkups. This may lead to undiagnosed conditions such as hypertension or diabetes, which then leads to, as I said earlier, life-threatening complications. Of course, there's also limited public transit in rural Alberta, making it nearly impossible to seek care without assistance, and many of us do not have those supports. Now, imagine a disabled person seeking mental health support. They have chronic pain, they're experiencing depression, they may face a 2-year or longer wait for services. The condition worsens, leading to hospitalization. And again, this lack of early intervention not only diminishes quality of life, but increases costs for the healthcare system. So what are some solutions? Well, first of all, one that the government will simply not engage in, which is to increase healthcare funding. And we know this government continues to decrease funding, continues to cut back on services. But if they wanted to support us, if we had a new government, they could reverse the budget cuts, invest in healthcare infrastructure, and look at things like long-term care facilities, community-based programs, and rural clinics. The government has said that they would like to strengthen workforce recruitment and retention, but it has not been very successful. In fact, if anything, it's gone backwards. How would they do this? If they felt the need to actually engage in this, they would, again, look at better working conditions, mental health support for workers in the healthcare system, and they would engage in better salaries. It's important to expand accessibility, so making sure that all healthcare facilities meet accessibility standards and providing subsidies for assistive technologies that can improve access to healthcare for disabled individuals. Again, we would need a government that actually wanted to do this. They can also improve long-term care oversight, establishing stricter regulations and accountability for long-term care homes would possibly ensure better outcome for seniors. And I can say, as someone who has made a complaint, we're not being listened to. They are ignoring us because the situation has become progressively worse. They could leverage technology. They could expand telehealth services, increase accessibility in telehealth services. This would be particularly important for disabled populations, older populations, and rural populations. And finally, they could promote preventative care. So investing in things like routine screenings and wellness programs would actually reduce the burden on hospitals and lower the amount of funds that were being put into emergency services and long-term care. The fact is that we're experiencing rising costs that many of us cannot afford, inadequate care, and this is an erosion of the system that is reducing accessibility, is reducing sustainability, is reducing health. If we rebuild the healthcare system, and I do unfortunately believe this will take a different government, we could change this, we could turn it back and start to see healthier individuals, fewer people with mental health problems caused by the stress and strain of not being able to access the system, better facilities for people who are older, better care, better preventative care. We have a chance to change this, but it's up to us, because the government is not going to do it unless we make ourselves painfully loud and clear that we've had enough. We want this to turn around. We need to get together. And with that, I say, if you enjoyed this video, please hit subscribe and explore. Please share with those who may be interested. Please remember that this is not just a problem confined to Alberta, it's everywhere. And remember, to be senior is to be proud. Hugs.